here. Remember, I've done my pericare, I've taken my gloves off, washed my hands are clean. I'm going to touch this and lift it without touching anything else in the inside of the kit. And then let it open out like this and slide it under your patient. And if I had a big enough bed, that wouldn't happen. So that's why you want to make sure that you have it set up properly. Now the problem is in checkout you're going to be using these little tables too. So for checkout, I think if you set it up here, it won't fall on you. It'll make your life easier. Okay, so you want to take your gloves out now and you want to just touch on the side again. You can touch anything else in the kit. And you see the way I moved my kit to that end, so I can come around here and I can open my gloves and I'm opening them, I'm not touching that sterile stick. And you want to put the gloves on. And really what we're checking out in this is if you can maintain the sterile field, and if you do break sterile field, that you know what to do to correct it. Okay? So any of you who have long hair, you want to make sure that you have your hair not in a ponytail but tied up, because when you bend over to look, you'll find your hair is in your sterile field. And you don't want that to happen, for your sake as well as anything else. Now you're going to take this fenestrated drape, and you're going to put that across the patient. If it doesn't fall in exactly the right spot, you want to wait until you're ready to commit this hand and then you can maneuver it around. You want to set up your kit here. First thing you want to do is take the sterile specimen container, take it out, put the top on, set it aside. You're not going to use it till later, so it can sit at the side. Then, if your kit has never been opened before, you'll find that your Foley cap has this blue thing on it. So if you're in checkout and you're taking this blue thing off, you want to make sure you control it. You don't just pull it, otherwise your catheter will flip. Take it off gently and set it back in there. And then you can get rid of this in your trash. Next thing is your Betadine. And you don't want to use that, just pretend that you're squirting it because it will stay in the dummies. And then separate your cotton balls. And we've got our sterile water. And you want to connect that to your balloon. And when you guys were in N200, they probably told you to check your balloon. You don't want to do that anymore. Your lubricant. Take a little bit of lubricant, because otherwise it's difficult to get the Foley in. You can use a little bit, and then lubricate your catheter, and then tuck it back in the box. Okay? So now you want to come over here, commit your hand, and get your drape in the right position. You can lift this, set it over on your sterile field here. And then you want to clean top to bottom, the outer labia furthest away from you. Top to bottom, the outer labia closest to you. Top to bottom, the inner labia. Top to bottom, inner labia closest. And then straight down the middle, right? And then you can get rid of this whole thing, because this is all trash, right? Then you can lift this box. Your catheter is tucked inside it, it's lubricated, it's all ready to go. Lift it by the side, bring it over here. Okay? Then you want to, this is where your hair gets in it if you don't watch. So you want to insert the catheter, tell the patient you're going to feel a little pressure. Ask them to bear down. How far are you going to insert it? Yeah, which should be like 2 to 5 inches. And then you want to go in a little more, and then hold it with this hand. So you can touch the catheter with this hand now, because this part of the catheter is not going to go into the patient. And then insert your water into your balloon. And usually the dummies, I don't put the whole 10 in because sometimes it explodes. It doesn't explode in the real patient, but in the dummies there's too much pressure in there. Get rid of that. So now you're going to take this out, and what are you going to do with your catheter? You want to hang it below the level of that. And when are you going to get your specimen of urine? You going to get your specimen right away? Yes. You want to let the bladder empty into the bag. Make note of how much urine came out, what color it is, if there's any sediment, anything like that. And once it's completely empty, which will be like 5 or 10 minutes, you can then clamp your catheter and just fold it over like this. Clamp it and wait 15, 20 minutes and then come back to get a specimen. And you're going to come back with a 10 ml syringe, lower lock syringe, alcohol swab. You want to clean off this blue port, scrub it for 30 seconds, and then use your syringe to withdraw 10 mils of urine and put it in your sterile container without touching the inside. Label it and send it to the lab. And then what's the most important thing? Don't forget to unplug. And why do we stabilize the catheter? So it doesn't get pulled or kinked. If the catheter is moving around and
Cause pain,
it can cause pain, what else can it cause?
trauma.
Trauma, and what does that lead to? It leads to irritation, and then you get infection. And whatever kind of fastening device you have, it always fastens around this little V, because this is what keeps it from moving. So if you put the fastener on here or here, the catheter will just slide, but this here stops. Okay. And then you would tear all this stuff off and clean up your patient. And you want to make sure you wash the betadine off them.